Today we talk about biostimulation and biorestructuration. I am Roberto Amore, plastic surgeon from Italy, and I am the founder of the company Love Cosmedical. It's a very popular concept today, the biostimulation. But what it is and what to use? Biostimulation is a technique that is able to enhance the main characteristic of the extracellular matrix of different tissues, starting from the epidermis and arriving to the deep subcutaneous soft tissue. The biostimulation was done by different mechanism of action. In past, we considered only injectable procedure like the so-called mesotherapy. But today we can include in this technique also the non-injectable procedure like energy-based device, like peeling, like radiofrequency, like high-focused ultrasound. In the biostimulation, we can have different effects depending what technology we are using. The main characteristic of RESTORA is the combination of biostimulation with the biorestructuration. Biorestructuration differs from the biostimulation because biorestructuration gives an increasement and improvement of the fibers of the extracellular matrix, but in a different way comparing to the biostimulation. Biorestructuration gives a small, controlled inflammatory process that give the reaction to the tissue to increase the quantity and the characteristic of the fibers. They are totally different processes, biostimulation and biorestructuration. Biostimulation give improvement using the normal physiological mechanism of each single cells and of each single layers. Biorestructuration give an improvement with a restoring process of each single tissue. So in one case, we stimulate naturally the layer. In the other case, we give a controlled damage for restoring process. Of course, biostimulation it's a more easy process and more faster in terms of effect. But the biorestructuration it's a more huge process, a more long process that give, of course, more important results. The innovation of RESTORA is the combination of two families of different ingredients. One family for biostimulation, one family for biorestructuration. So, in the family of biostimulation, we have collagen fragment, we have amino acid, we have low molecular weight hyaluronic acid, we have peptide and antioxidant agent give biostimulation. So they promote the normal synthesis of fiber using the normal process of each single cell. Keratinocyte, fibroblast, pre-adipocyte, mesh adipocyte. The other family that was done by two ingredients, calcium hydroxyapatite and polylactic acid, give biorestructuration. So the microsphere of those two ingredients give a tissue reaction. So we have the controlled inflammation and we increase the synthesis of fiber by restructuration of the process. At the beginning, with the biorestructuration, we have an inflammation that starts in days. After, we have an increasement of the fibers of the extracellular matrix that was done in weeks. The third step of the biorestructuration is remold and reshape the tissue. The increased fibers were remodeled in order to have a changement of the characteristic of the tissues. RESTORA combined those two ingredients for give a very important effect in terms of tissue enhancement, but of course tissue improvement of quality. The protocol is to use one session every 4 weeks for 2 sessions and repeat the 2 sessions after 6 to 9 months. Generally, the target was those patients that have a very saggy skin, a very loss of elasticity. In this case, we can use RESTORA to improve the lower third, the middle third of the face, but of course can be used for the improvement of the neck, of the décolleté, back of the hands, and some specific body areas. RESTORA can be used alone as a single technique or in combination with other technique. Depends of the characteristic of each single patient. You have to customize the protocol and tailor the protocol directly on the patient. To use RESTORA means that you understand the power of biostimulation and biorestructuration. They are very, very important techniques that give the first step for a more beauty. Patients nowadays understand very well that before correct each single defect, it's more important to take care of different layers, starting from the skin and arriving to the bone.